Welcome to Bonita's Maternity Program webinar. Today, Annegret Wilsdorf, a physiotherapist, will be taking us through the important aspects of preparing yourself for childbirth and recovery thereof.
Good day, everyone. So the most important thing really is to know what's going to happen in order to prepare yourself for pregnancy and for childbirth. So the main goal is that we need to promote healthy practices, minimize any excess anxiety, and also any discomfort of pregnancy and labor. So during pregnancy, many systems in the body are affected by changes. As you can see on the list in front, there are quite a few systems that are involved. The main ones that we will be focusing on will be the musculo-skeletal changes and the postural changes. So looking at this picture in front of you, the most obvious thing that you see is obviously an increase in abdominal size and breast size. So during pregnancy, the uterus changes from a pelvic organ into an abdominal organ, and it actually gains quite a bit of weight. So the uterus usually is about 50 grams, and it then changes into about a kilogram organ. Then obviously with the baby inside and all the other extra fluid, that also increases the weight. Also, you can see that there's a change and an increase in breast size and volume. So all of this is all in the front part of the body, and this almost makes the body want to fall forward. So in order to compensate for this falling forward change in center of gravity, the spine obviously has to go through a few changes. So you have an increase in the lumbar lordosis, so the lumbar curve at the bottom. Then due to that, you then have this change in curve in the middle part of the spine, and then also a change in the neck, in the curve of the neck. So with this, there's this increase in weight in front. There's a total increase of body weight, which increases the BMI. Because of this growing uterus in front, you also have quite a stretch of the abdominal muscles, and there could even be a separation of the abdominal muscles in the front of the body. Because of the change of the lumbar spine and the abdomen, you have a tilt of the pelvis. So you can see the joint in the front area and the two joints in the back area also have a bit more wear and tear and pressure on them. Due to these curves, you also then have an overuse and a shortening of your lumbar muscular system, which could then also add to some discomfort and pain in the lumbar spine. And also there's lack of support coming from the abdominal areas. Moving upwards, you have this rounding of the shoulders, also with an increase in breast size as well. And that could also put quite a bit of pressure on the neck area. So you can see that there are quite a few areas, just looking at the posture and the musculoskeletal changes, that can take a little bit more pressure during pregnancy than they would with normal alignment. There's also a bit of a change in motor neuron firing, which just makes the muscular system a little bit weaker. And that could also add to just being a bit more tired, especially towards the end of pregnancy. So looking at this picture, you can see how the uterus changes from a pelvic organ into an abdominal organ. And right at the top, you can see that the uterus pushed quite a bit into the diaphragm, so it's very close to the rib cage at the top when you're about 36 to 38 weeks. Then obviously there's a bit of a change, there's a drop in the uterus because for the preparation of childbirth. But this growing uterus changes the angle of the rib cage. So you can see without being pregnant, there's a much smaller angle in the rib cage than what you would have when you are pregnant. So that becomes quite wider. And then also, if you look at the diaphragm positioning, you can also see that the uterus pushes the diaphragm quite a bit higher in pregnancy than in normal life. And this will then obviously affect the lung capacity and lung function. With the change of hormones during pregnancy, you also have an increase in relaxin. That's just a hormone to prepare all the joints to be a little bit more flexible during pregnancy and then also in preparation for labor. your body prepares for normal labor, so it needs to have as much flexibility around the pelvis in order for you to be successful with the normal vaginal delivery. But with this change in hormone, you can also get that these areas over here where my arrow is now become quite uncomfortable because you have this irritation and pain of the costochondral joint. So those are just really where the ribs attach as well. Okay, so we've run through most of these. We have the rib flaring. Just important to remember that this hormone change really recovers at about 6 months postpartum. So after you've had your baby, about 6 months down the line, your hormone levels are back to normal. Breastfeeding can sometimes be influencing that as well. Okay. Unfortunately, also with other changes in the body, you do tend to have a bit more edema. That could accumulate definitely around the ankles and the feet, and then the lower limbs, and then also around the carpal tunnel area, so that's around the wrists, and then also under the arms where the brachial plexus comes out. Now, the importance of this is that you could have a bit of compression on those nervous systems, and that could cause a little bit of weakness in your hands and numbness in your hands as well. This really should recover in the postpartum period. Sometimes women can struggle a little bit longer with this fluid retention. So common complications and changes that happen during pregnancy that we just really touched on was this gestational weight gain that you do get. There could be a lumbar-pelvic pain. There could be diastasis recti. Now, this was the separation of the abdominal muscles that I spoke about earlier. There could be this increase in fluid volume, which causes edema and swelling in those areas around the ankles and the wrists and under the arms. Muscle cramps, a common complication, and they especially get you at night when you're sleeping, and then you have severe calf cramps. Constipation, nausea, and gastric reflux is also, so that's also something that could be problematic during pregnancy, and that's also due to the change of the progesterone hormone. A pregnant lady could develop gestational diabetes. There are other complications as well, like preeclampsia, but that will mostly be managed by a gynecologist. The above mentioned changes that we just mentioned could all really be addressed with a very moderate exercise program, and that is definitely something that we do recommend during pregnancy, is to continue with a moderate intensity exercise program. So really in this preparation, where do you start? Information is really key. So the more that you know, the better. But it's not necessary to become too paranoid about all these changes that can happen. Everybody is not the same, and you might only experience just a few of these changes. So the signs and stages of labor is important to know, so that you know that, you know, when you get to about 38 weeks or 40, closer to 40 weeks, what the signs of labor would be, and that it would just not be normal back pain. Stages of labor, if you do plan to have a normal vaginal delivery, the first stage would be from when you start having severe contractions, where your cervix is about 0 centimeters dilated, and that increases to about 10 centimeters. So that would be the first stage of labor. The second stage would then be the part where you actually deliver the baby. This is normally shorter than the first stage of labor. And then the third stage of labor is where you actually have the placenta delivered as well. Good to find out who is a breastfeeding consultant or a nurse that specializes in breastfeeding that's quite close to you. Good to contact them and just have a little bit more information. You can read up, there's a lot of information on the internet as well about breastfeeding positions and latching. It's good to know all this, because breastfeeding, if you plan to breastfeed, will make quite a big part of your journey postpartum. So it's good to start with good ergonomic techniques during your pregnancy already. So if you do need to do anything at home, say if we have an example of doing some housework, if you have to pick up something or if you need to move something, if it is too heavy, make sure that you have someone that can help you. Or if you really need to move it, find different ways of approaching it. So make sure that your body is as close to the object as possible, and that you really use your legs to bend down and pick up whatever needs picking up. If there's anything like a couch that you can just move with your bum and kind of shove it along, that's also easier than actually bending down and lifting it. So it is important to just take care of your body during the pregnancy phase. So this is important to continue with afterwards, even though if you do have a normal vaginal delivery or cesarean section. The kinetic handling in the postpartum period is very important, because you need to either take care of a cesarean section wound, or you need to take care of a bit of a painful perineum after the delivery of a baby. And you could also have a little bit of lingering lumbar pain, and some things that were present during your pregnancy could still be lingering afterwards. And then, like I said earlier on, breastfeeding does make a big part of the journey in the postpartum period. And it is also important that you are as supported as possible when breastfeeding, because breastfeeding can last anything from 20 to 40 minutes per feed, and you need to be in a comfortable position and not strain any other areas, especially your neck and shoulders, when you breastfeed, because this would be a regular occurrence every day. So general rule of thumb is that you do about 20 to 30 minutes of moderate intensity exercise every day. And remember that moderate intensity, you must still be able to have a bit of a talk with someone next to you. It is not that intense that you are not able to breathe properly or being able to say anything. Remember, the body goes through quite a few changes, and you just have to respect that in this period. It's important to not try any sort of new exercise program during pregnancy. So if you've always been a runner, or if you've always been a walker or a racket sports player, you can continue with those activities during pregnancy if you don't have any other complications. But please don't try and do any sort of mountain climbing that you've never done before. So an exercise protocol that I can recommend is that it should include some active stretching and mobilization of the spine. Definitely exercises for the lower limbs to improve that venous return and also address that swelling and calf cramps that is common during pregnancy. Abdominal exercises should be included, especially if you're going to plan for a normal vaginal delivery. They have found that with an increased strength of abdominal muscles, that definitely helps in the pushing phase in the second stage of labor. If you struggle with any sort of diastasis recti, so the separation of the abdominal muscles, it's good to include specific abdominal exercises to address that gap that you're developing. And if you struggle with any pregnancy-related pelvic girdle pain, definite increase in strength and endurance of the abdominal muscles could help decrease the pelvic girdle pain that you're struggling with. So perineal massage and a warm compress during labor has been effective in decreasing the amount of pelvic floor muscle trauma that you do have with a normal vaginal delivery. Literature has not really found that it's been that effective when done in the antenatal period, so before childbirth, but it can't do any harm. So if you do want to add a little bit of perineal massage, I can't see that it will do any harm. Then, of course, include a relaxation and breathing exercise program. There are other healthcare professionals that can definitely help with having the correct breathing techniques and the correct breathing techniques specifically during labor. So they have training programs where you have specific breathing techniques, definitely when the contractions are quite severe during labor. Then there's also this progressive relaxation techniques that you can use prior to childbirth, and then also quite a bit of visualization that is included with that. We talked about the phases of labor, so that's just a quick recap. Then diastasis recti that I spoke about earlier, I just thought I'll include a few pictures just so that you can see what a diastasis recti looks like. So that's basically an unzipping of the muscles in the middle part of the body, and that could be in different forms. So you could have this complete unzipping of the middle part, or only the lower part of below the umbilical area would unzip, or the top part, or then there's a complete open diastasis where it's not just down the middle but also in between. So that's quite a bit of a stretch of the fascial area between the abdominal muscle system. Unfortunately, the more severe the diastasis during pregnancy, the more difficult it is to actually recover postpartum. But important also to just make sure that you don't have this doming. So when you have that doming of the abdominal area, it just means that the pressure control in the abdominal cavity is not optimal, and you're actually pushing abdominal material into that open area, and you could actually make the diastasis more severe. So if you notice that, make sure that you mention that to a healthcare professional so that it can be addressed properly. And also about 3 months down the line after childbirth, and it is important that that should really close up. If it doesn't, also make sure that you contact a healthcare professional. So just a quick look at the pelvic floor. So the pelvic floor is at the bottom of the pelvis, and it really just supports your bladder, the uterus, and the rectum and colon. It also helps with any support of incontinence, so that could be urinary incontinence or fecal incontinence. So pelvic floor muscles, you can call them your knijpspieren or they do the Kegel exercises, but that's really just all in the same. On the picture on the right, you can see that there are quite a few small muscles involved, but they're almost like small pieces of a rope. And together they form this nice, strong pelvic floor base at the bottom of the pelvis. Right, so it is important that you do start to exercise your pelvic floor muscles before pregnancy, during pregnancy, and after pregnancy. During pregnancy, there is this descent and stretch and elongation of the pelvic floor muscles, obviously because there's quite an increase in weight from the uterus and the baby that you are carrying. And then there's this added change with the increase of the hormone relaxin in the body to accommodate even more stretching in the preparation for childbirth. So then during a normal vaginal delivery, the pelvic floor does stretch quite a bit further. And in some cases, and that's mostly with the first baby, you do struggle with some perineal tears. It could be a first to a third degree tear. You could have an episiotomy to accommodate the baby's head that's coming out. And unfortunately, it could be an anal sphincter tear if there's quite a severe pelvic floor, like a third or fourth degree pelvic floor muscle tear. These could contribute to some urinary incontinence and some fecal incontinence symptoms after childbirth. And just very important that you do address that and not start a severe exercise program postpartum and you still struggle with these symptoms. So to do a correct pelvic floor muscle contraction, you can be in any position, but it is easier to start in a crook lying position or a sitting position because you do get a bit more feedback and you could concentrate and focus a bit more on those positions. Important that you start in a static position. In other words, that you're not moving and not while you're walking, because while you're walking, it can actually be a bit more difficult to try and recruit pelvic floor muscles. Important when you do the movement that you don't do any breath holding. Someone else shouldn't see that you are doing a pelvic floor contraction. It should be easy contraction without any sort of external things that you can see happening. So when you're sitting on a chair, you should be able to feel the pelvic floor lift up from the chair when you're doing a contraction. So the pelvic floor movements in females really start around the back passage. And if you can imagine that you are either holding back wind or if you are stopping the flow of urine midstream, so it's that lift movement that has to happen inside the body. There shouldn't be any contraction of the gluteal muscles. You shouldn't have any breath holding. It should just be a gentle squeeze and lift from the back passage up and inwards. And that should actually lift up towards the front part of the pelvis, in other words, towards the vaginal area or the pubic symphysis. That is really the pelvic floor contraction. That contraction should be repeated for about, let's start with 5 repetitions. You should have a full contraction and a full relaxation. Full contraction, full relaxation. It's still a muscle at the end of the day, and in order for the muscle to have a full contraction, you should have a full relaxation in between. So that is just your fast, start off slowly, but that would be your fast, strong contractions. Then the same contraction should be done, 1 contraction, but then you need to hold that contraction for about 5 seconds. So same contraction, 2 different approaches. So the one would be a strong contraction and a proper relaxation, strong contraction, proper relaxation for about 5 repetitions. And the other one should be 1 contraction to about 70–80% of the maximum power of the muscle. And then you need to hold that for about 5 seconds. And remember, no breath holding or bum squeezes or leg squeezes should happen during this pelvic floor contraction. That could be increased to 10 repetitions and 10 seconds. That could even be increased to 12 repetitions and 12 seconds. Now, they don't really recommend that you try and do much more than that, because unfortunately it is a muscle at the end of the day and it does get tired. But good to start with these pelvic floor movements during the pregnancy, and definitely as soon as possible after birth. There might be a slow recruitment after birth, especially in normal vaginal delivery, but just start somewhere and get the pelvic floor moving. Right, so just one thing to remember during pregnancy is, because of all the hormone changes as well and the expanding uterus, there is a bit of a slow transit in the colon, and that could contribute to constipation. Make sure that you address the constipation, diet, water, exercise, and in the correct toilet position. You could also add any sort of medication that could help, an osmotic laxative that could help move the stool easier through the colon. So that is just a nice picture of recommended position on the toilet. That footstool might be a little bit high, but you get the idea that your feet should be propped up. You should be in a relaxed position. Your knees should be a bit higher than your hips, because that allows for a different tilt in the pelvis. It straightens out the rectum, and it also helps to relax the pelvic floor muscles a bit better. So that in the event of having open bowels, there could be a more successful emptying of the bowels. Obviously, the less constipated you are, the easier the movement would be. So definitely make sure that you address your diet to make sure that it is easy to get stool to move through the colon. When sitting on the toilet, please take your time, relax your pelvic floor as much as you can. You can lean onto your knees. In the picture, they have someone holding a newspaper, but you can hold whatever you want, or you don't have to hold onto anything, but relax onto your knees, and make sure that you really take a few deep breaths into the abdomen so that the abdomen swells out. As you breathe out, you have this forceful sound that also just activates the external obliques, and that just helps with a little bit of pressure to see if you can get the stool to move out. Try not to do a major Valsalva movement, because that doesn't only push down the bowel, but it also pushes down all the organs in the pelvis, and that could really add to pelvic organ prolapse symptoms. So what does the literature say about exercise? There are quite a few positive effects. So it definitely decreases the gestational diabetes and weight gain that could be present during pregnancy. Stronger abdominal muscles, definitely for better pushing in the second stage of labor. It can definitely help to decrease that lumbopelvic pain that you can have during pregnancy and obviously after pregnancy. And then also, the stronger your muscular system, that would be the abdominal system and definitely your pelvic floor system, that can address any sort of incontinence even better. They have found that exercising mothers might have a slightly lower birth weight of the fetus of the baby, but they found that the newborns have less fat mass and greater lean mass. So it's not that it negatively impacts your baby at all. Your baby just has a little bit less fat mass at birth. Unfortunately, obesity is a risk factor for a longer first stage of labor. So where you go from 0 centimeters to 10 centimeters in the first stage of labor. And they have found that fitter women might have a shorter first stage of labor. They also seem to have less incidence of cesarean sections, the fitter and the stronger you are. And also, an exercise program can really help to reduce stress and anxiety. And at the end of the day, they found that stress and anxiety could have a negative impact on the fetal birth weight and preterm labor and even fetal distress. So really try and stay as calm during your pregnancy as possible. So, are there any risks when doing exercise? When doing a light to moderate intensity exercise program, they've really found that it doesn't contribute to any miscarriage and it doesn't contribute to any preterm labor. But it is important that you don't exhaust yourself or overexert yourself. Make sure that you can do that talk test that we talked about earlier on. And unfortunately, it doesn't seem that exercise has any impact on the presence of inductions or episiotomies or any epidurals. They need a little bit more further research in that area. So women should not exhaust themselves or overheat. After about 16 weeks, you should be careful of lying on your back for long periods, and that is definitely something that you need to consider when you're doing Pilates classes. Don't lie on your back for too long, and if you do start to feel uncomfortable, please change your position, because there is this compression on a big vein in the lower part of the abdomen that could contribute to quite a bit of dizziness and not feeling well at all. Take care with changes in body position because of the effect on the cardiovascular system. It could cause dizziness. And then just avoid extreme heat areas like saunas and really hot pools, because you raise your core temperature and you could really feel terrible. So which exercises are recommended? Walking, stationary bike, swimming, water aerobics, and then obviously Pilates and yoga. And then, like I said, if you were a keen runner or racket sports player before pregnancy, with the guide of your doctor, you can definitely continue with those exercises if it doesn't cause any complications. And just a few things to look out for: any bleeding from the vagina, dizziness or feeling faint, shortness of breath, chest pain, headache, severe muscle weakness, calf pain, redness and swelling of the calf, and regular painful contractions of the uterus, and then any sort of fluid gushing or leaking from the vagina. Please stop with your exercise as soon as possible, and then also contact your obstetrician if you have any of those sort of symptoms. So in the postpartum period, so this is now after birth, like I said, pelvic girdle pain is something that could continue in the postpartum period. There could be some pain due to the cesarean section that you've had, or the episiotomies or pelvic floor tears that you've had. Diastasis recti, the separation of the abdominal muscles, is something that you need to look at. Definitely make sure that your latching and positions in breastfeeding is optimally used. Kinetic handling of the baby, it's also something that you need to look out for in the postpartum period. Make sure that your pram, your car stool is not the heaviest thing in the world, and that it is quite comfortable and easy to move around, because that could become quite difficult to get a car seat out every single time when you go somewhere and just make life as easy as possible for you. Exercise in the early postpartum period is important, but just be aware that you don't have any unwanted symptoms during those exercise periods. Painful intercourse could be something that could be problematic postpartum and might actually stay for longer periods. And then, of course, any sort of urinary or fecal incontinence. Just a couple to remember when you do attempt exercise after childbirth, that there is definitely a wider vaginal opening if you've had a normal vaginal delivery. It can take up to about 12 months for that to return to its previous size. And pelvic floor muscles, the connective tissue of the pelvic floor muscles, and then obviously of the abdominal muscles as well, they were under quite a lot of stress and strain from stretching and can take to about 4 to 6 months to recover. There could be some mobility of the bladder neck after vaginal delivery. Cesarean section, obviously you need to consider the uterine scar needs some time to heal. And then the abdominal muscle fascia only has about 50% strength at your 6-week follow-up period. So just keep these things in mind when attempting an exercise program in the postpartum period. It is important to start with a light intensity exercise program as soon as possible for the first 3 months after childbirth, but try and avoid high impact activities for about in the 4 to 6 month period, because of all these things that we spoke about earlier on. Relaxin also remains in the body for up to about 6 months afterwards. So start with an easy program with pelvic floor exercises, basic core exercises, and walking in the beginning. That you can progress to a bit longer distance walking, and slowly but surely you can increase the intensity of your exercise program. You can have a look at these recommendations if you want to at a later stage, to just gradually increase your exercise program as time goes by. These are just guidelines. If you struggle with any complications, make sure that you consult a healthcare professional as soon as possible before you up the intensity of your workout plan and you just struggle with more complications. And running is really something that you need to be careful of when you return, because it is a high impact exercise. The important thing of running is that, that your child is as supported as possible. So make sure that the buggy that you're going to use gives enough support for your child that is in the buggy. And really, they shouldn't be any younger than 6 months. They need good head control when you do position them in a buggy, and also make sure that it's got good wheels, a good harness, and good suspension when you start with the running program.
Thank you for joining our webinar.